Hello, my name is Dr. Kiriakidis. I would like to thank Babble for the opportunity to discuss today a very important matter. Male infertility is a very important and very integral part of IVF treatment. I have with me a very good colleague, our senior embryologist, Mr. Achilleas Papatheodorou.
Hello.
And, we're going to discuss the current aspects of male infertility.
I would like to thank Babble for this kind invitation, and thank you, Dr. Kiriakidis, for the introduction.
Achille, we regularly welcome many questions in our offices from men that are about to start their IVF treatment on when they should have their first sperm test. The clinical answer is that any couple that is trying to conceive for more than 1 year should be thoroughly examined and checked for any problems that could cause difficulty. Sperm is one of these tests. How is sperm evaluated these days? What are the current tests that we have available?
Well, first of all, I have to say that the sperm test is an essential test for a couple that is under investigation for infertility. And well, actually, we have to check about their concentration, which means we need to see how many spermatozoa there are in their semen sample. And then we have to see if the spermatozoa are motile or immotile, so we check for the motility. And then, very important parameter is the morphology of the sperm cells. And there are specific guidelines from World Health Organization about the testing of sperm samples. And there are specific parameters and specific limits that we need to, well, for sperm, in order to consider normal, it needs to be above those limits. So when we test the sperm, we check whether we are above these limits, and then we can consider it as a normal sperm sample, or a sperm sample that is in the limits, or well, lower, an abnormal sperm sample.
So basically, the man will need to provide the sperm sample. Yeah, and we try to see how much spermatozoa is contained in the sample. We try to see how they move and how they look, how they appear.
Exactly. Yes.
So the man will need to abstain for a couple of days, and then he provides the sperm sample, which is then analyzed. And the sperm, usually one sample is sufficient to do the semen analysis and also to do a sperm culture, a semen culture, which in this case, we try to distinguish whether there is any bacteria inside the sample.
Yes, it's very important to see also and have a test for culture. Because maybe there's a possibility of bacteria. This bacteria could induce more infertility problems in the couple. And there are a lot of research saying that when there is bacteria in the semen sample, this could affect sperm concentration, motility, and morphology. So it's important to test the sperm for any microorganisms, I would say.
Do you think that if there is any bacteria present inside the sperm sample, this could also affect the fertilizing capacity of the sperm?
It could affect it, yes. Well, when there are when we do the laboratory procedures, we try to remove all the semen liquids that where this bacteria live, in order to isolate only the sperm cells and do the fertilization using only sperm cells, free from any bacteria. But generally, we've seen that when the sperm samples are free of any bacteria, the fertilization rates are higher.
That's very good. So this is where doctors come in, and when we find that a man has a positive sperm culture and needs to undergo treatment, we start early. We start even before the woman starts her part of the treatment, in order to achieve a more, let's say, sterile sample on the day of the egg collection in the fertilization.
And I guess you need to give some time in case that there is any bacteria, to give some time for man to take an antibiotics and to repeat another culture test and be able to go for a treatment without any bacteria.
Let me add here that antibiotic treatment, even during the or around the period of the egg collection, does not at all affect spermatogenesis. In fact, if there is even a suspicion of bacteria in the sperm, it will actually improve sperm quality on the day of fertilization if the man is undergoing antibiotic treatment at that point.
Yeah.
So this is a more quantitative way to evaluate the sperm. We do the sperm test. We see the initial results may show us some problems, but they can lead up to a normal sperm sample. But knowing that some couples have several unsuccessful rounds and failed transfers, we try to move one step forward and try to, in a more quality-oriented evaluation. And we come to the DNA fragmentation and the fish of the sperm. These are a more a look into the quality and this fertilizing capacity of the sperm, and also how the embryo will develop later on.
Yeah, that's true.
For a man to have a DNA fragmentation index before they start IVF?
Well, I would recommend to look for any DNA fragmentation in sperm samples. You know, there are several cases where the sperm is fragmented, it is broken, and when an embryo is growing and at some point needs specific information from the DNA of the sperm. And if the DNA is broken, then the embryo cannot grow up, and at that point we see embryos in the laboratory that they arrest. Also, there are a lot of indications when we have a lot of negative tests after a lot of IVF cases with negative results. These kind of cases, they have usually they have an increased DNA fragmentation index. So it is important to test for this phenomenon. And then there is also the fish analysis, where we look in sperm sample, and we're looking for aneuploidies in sperm cells. When we talk about aneuploidies, we mean that there is a wrong number of chromosomes in sperm. So at that cases, this kind of sperm will give more embryos with haploids, and these embryos will result in no pregnancy or in miscarriages in the first trimester. So we would recommend to have a test like that in couples before treatment. And I don't know what's your opinion as a physician.
Indeed, in my experience, when we have cases where we see either recurrent miscarriages or unexplained complications during the first trimester of pregnancy, and we try to search more thoroughly how the sperm looks, we find ourselves with problems with the DNA, and it's an established knowledge at this point that a high DNA fragmentation or abnormalities with the consistency of the chromosomes shown through the FISH analysis can lead to miscarriages during the first trimester of pregnancy, and also could lead to genetic abnormalities of the embryo. Mm-hmm. And this is why we, in Embryolab, we usually ask for the men to have these tests before they start their IVF journey, because we need to be prepared, basically, because there are some things that we can do laboratory-wise. Achilleas will tell us what we can do, but there are some things that we can do for ourselves before we start the treatment, basically to try and improve sperm quality. And these basically include changes with our lifestyle, changes with our everyday life, our bad habits that we may have during our daily routines. I strongly recommend that men and women should stop smoking when they are starting to consider IVF, and they're trying basically to conceive. They should improve the diet habits and their diet routine. They should increase their vitamin intake, and daily exercise should also be increased in a way to improve well-being. And if I'm not mistaken, Achillea, your experience shows also that if you try with an antioxidative treatment before you start IVF, you see improvements with the sperm.
Yes, that's why it is important to do this test, in order to, if you see increased fragmentation index, then you can propose to this man to do an antioxidant treatment, which also has a lot of vitamins. And this treatment will last 3 months. And then in 90% of cases, we see an improvement in DNA fragmentation index. And then men come and they repeat the test, and we see a much better index. And this will give us the opportunity to have a better sperm available the day of the pickup, and we will have a better outcome in laboratory. And usually we have a higher blastocyst rate, and we've seen, of course, improvement in clinical pregnancy rates. So this is important to monitor DNA fragmentation index. And if the index is not improved, then we might need to give more time with this kind of treatment. And at the end, if we see no improvement, there's another approach in this kind of cases.
Good. Let me interrupt you there, because in Embryolab we are very big fans of holistic treatment, and this is why we include nutritionists, we include acupuncturists, counselors in our treatment, and they apply not only to women that undergo the treatment, but also to men. So I regularly advise couples visit nutritionists to improve the diet even before they start the IVF. And your experience shows that improving the sperm through lifestyle modifications can greatly improve embryo development. But there are a few cases where this is not sufficient, basically. And even though couples change their bad habits and they stop their bad habits, On the day of fertilization, which is the first day basically of the laboratory part of the treatment, we realized that we have a problem. Is there any laboratory method or technique that we could use to help slightly further this couple?
Yes, there are several things that we can do in the laboratory. So this is when we take over and we try to make a few techniques in order to, actually what we're trying to do is to select the best spermatozoa from the sample that we have the day of the pickup. Well, one of the things that we do and we recommend to the couples when we don't have good sperm parameters is to use the IMSI technique, which is, well, it's a specific microscope that has some lenses that you can achieve high magnification. So we can look much better at the head of and then the morphology of the spermatozoa. And we can see some features that you cannot see with a normal microscope. So we can choose better microscope, and we've seen better fertilization rate, better blastocyst rate, and we've seen an improvement in clinical rates in many unexplained infertility cases. So that's what we're doing with this kind of cases in Embryolab. And well, we combine it with with another with using also technology in our incubators. We have incubators with the technology of time lapse, which means that we monitor the embryos all the time, and we have videos with the embryos how they grow. So these kind of cases, we put it actually free of charge in embryoscopes, and we can see the development of the embryos, and we can distinguish which embryo is better than the other. And by doing this, in combination also with IMSI, we've managed to have much better clinical rates. And well, we had some cases where I can remember that they had 3 or 4 failed IVF attempts, and we managed to have, I remember last week, 4 beautiful blastocysts. And I can recall several cases that we managed to have a healthy baby by doing this, by using this approach.
So when we see problems with the sperm, I want people to realize that it's not the end of the world for them. There are ways that we can help. There are ways that we can improve the sperm even before it reaches the laboratory, but there are also ways that we can improve its ability to fertilize and its function basically even after they give us the sample. But before we close, I wanted to mention one last thing, which is also very, very important, because this is a way that we give hope to many couples and many men that face a more serious problem, and that's the problem of azoospermia. Basically, azoospermia is the absence, the total absence of a spermatozoa from the ejaculatory sample. And in cases where we are dealing with azoospermia, the clinical part involves a testicular biopsy, which is basically the retrieval of sperm from the testis and the use of testicular sperm then for fertilization. This is not only a very sophisticated form of treatment for this man, because it involves a minor operation, but it's also a very sophisticated form of fertilization for our embryologists, because they need to seek the sperm inside the testicular tissue. They need to find mature sperm inside the testicular tissue, where, as far as I understand, it's hard to find in a tissue where it contains mostly immature spermatozoa to find that mature sperm that will give you the correct embryo at the end. So our experience in Embryolab with more than 1,000 cases in the past 15 years have shown us that we have very good results with the testicular biopsy and the use of testicular sperm in the laboratory. Can you describe, Achilleas, our experience from this form of treatment?
Oh, yes, I have to say that, well, in cases that we had well, azoospermia, using this kind of techniques it was a game changer. Well, in the past, when we have an azoospermic man, actually he had to go for a sperm donation, but using fine needle aspiration or testicular sperm extraction or microtesticular sperm extraction, we have the possibility to give a baby to this man. And yeah, as you said, in Embryolab we have like more than 1,000 cases the last 10 years. And what can I say is that we have around 80% chances of finding spermatozoa in cases with azoospermia, which is a great number. And the fertilization rate is a bit lower than with a fresh sperm. Instead of 80%, it's like 60-65%, and depending from the quality of the sperm that we will find. But still, it's a very good number, and it can give us a lot of embryos in the laboratory. And I have to say that in Embryolab we combine these cases always using embryoscope in order to be able to distinguish embryos and to get the positive result as soon as possible. And we recommend to do a culture day 5, a culture of blastocysts, to leave the embryos develop for 5 days in order to see that the sperm that we have selected can contribute to the development of the embryo, which is happening after the 3rd day of their development. And I can tell you that in women under 35, 1 to 2 women actually they take a baby at home. And in women over 35, 1 out of 3 can have a baby at home using this approach.
That's very impressive, basically, because this is a technology that wasn't around 2 decades ago. It's a technology and information that we receive daily, and we improve, and we try to improve our practices. Unfortunately, there will be about 20% of men that we cannot find sperm. And in that case, there is an alternative scenario that involves obviously a sperm donor. And this is why our clinic collaborates with all the major sperm banks in Europe. And we have available in our cryobank hundreds of samples, basically, of sperm donors that have been thoroughly tested and thoroughly screened before they have provided the sample. So basically, I have a very positive essence that although it is a very difficult problem to solve, there are solutions for male infertility. People and couples should not lose hope when they find themselves with these difficulties. And this is the reason that we had our discussion today, basically, Achilleas. Would you like to say anything, any final remark?
Well, I would like to say that all of these years in field of IVF actually was looking at women's infertility problems, and they weren't actually exploring a lot the men parameter, well, the parameter of male infertility or some hidden problems that hidden parameters that could affect the male infertility. But we have another different perspective in Embryolab, and we know how important is sperm and how important is to prepare the sperm sample in order to have better outcome and better clinical outcome. So we need to be prepared. So that's why we try to investigate it a lot before we start the treatment of the human. And there are a lot of things to do. We described some of them today. And in most of the cases, we can achieve great things, and we have really good results. That's what I would like to say. Don't lose hope. There are a lot of things that you can do. And we are here to help you.
So on my part, I would like to thank IVF Babble again for the opportunity that was given to us to discuss today. And I would like also to welcome any couple that wants to have a fruitful discussion with me or with Achilleas to meet with us in one of our future sessions, presentation sessions, either online or on-site in central London when times allow. Thank you very much.
Very much.